without protective clothing. Coronaviruses are dangerous for people who have weaker immune systems, like young children and older adults. To protect yourself from the virus, try to avoid contact with people who display symptoms similar to those of pneumonia or the common cold, like coughing or a runny nose. Don't touch your eyes, nose, or mouth with unwashed hands. Wash your hands frequently with soap and water and scrub for at least 20 seconds. Use alcohol-based hand sanitizer when possible. Be careful when handling pets. The only current treatment for coronavirus being offered is supportive in nature. If you notice any of these symptoms and conditions, please contact your nearest professional healthcare setup. Help spread this information to everyone.
When you feel a sneeze or a cough coming, try to prevent sneezing or coughing into your hands, as this will to your hands and spread germs. Your mouth prevents the spread of germs. You probably knew that, but the way you cover up also matters. And that means breaking a habit you've done all your life. Cover your mouth and no flexed elbow or tissue, not your hands. Discard the used tissue in an appropriate bin immediately. Then wash your hands with soap and running water to help stop the spread of germs. Turn on water, wet hands. Apply soap and lather up. Focus on washing your hands for at least 20 seconds. Wash the front of your hands, the back, between fingers and around the nails. Rinse hands under running water. Use something clean to wipe your hands, preferably a disposable paper towel. The best way to wash your hands is using running water. But sometimes we don't have that available. When not available, use hand sanitizer that should at least 60% all content. Your health is your responsibility. This message was brought to you by the Ministry of Health, St. Kitts.
To avoid getting the coronavirus, wash your hands thoroughly and frequently before and after food, after using the toilet or changing a diaper for a baby, sick person, or the elderly, after blowing your nose, and after leaving large gatherings or moving away from persons ill. Encourage others to wash their hands and also use an alcohol-based hand sanitizer of 60 to 70% solution. Stay away from events having large gatherings of people. You can expose yourself to more possible infections in large groups. Also, avoid sharing cutlery, cups, glassware, etc. with others. Viruses can linger on these items and may be transferred this way. Avoid shaking and holding hands, and hugging or keeping an infected person in close proximity. This is a message from the Ministry of Health and the National Emergency Management Agency, NEMA.
Before touching the mask, clean hands with an alcohol-based rub or soap and water. Take the mask and inspect it for tears or holes. Orient which side is the top side, where the metal strip is. Ensure the proper side of the mask is outward, colored side. Place the mask to your face. The metal strip or stiff edge mask so it molds to the shape of your nose. Pull down the mask's bottom so it covers your mouth and your chin. After use, take off the mask. Remove the plastic loops from ears while keeping the mouth away from faces. To avoid potential contaminated surfaces, discard in a closed bin immediately for use.
We're doing our part to help making sure that the coronavirus doesn't spread anymore in St. Kitts and Nevis.
It's just sure that the public being safe, and then we're keeping ourselves safe. We're ensuring that each other keep 6 apart.
I like the fact that they put this into place because most of the time the people are not honest. They tend to come and cheat, and many people who are here from since 6, 7 o'clock in the morning, standing up waiting long, other people coming and excusing themselves.
Some of them are part, and the others are jumble up too much on one another. In the market, where I have people in the pharmacy, they're cooperating very well, and it's a good thing that they're doing. Very good.
I am very passionate about being here, performing my duties on the front line of COVID-19. It's not easy, but we all know that someone has to do it.
It's not an easy job, it's not easy, very difficult, but however, conscious about self and we managed to take on the task.
Sister, you shall step up the police them money because they out here in the hot sun to keeping the people them from fighting and shoving in the line. And what they do very, very good.
We're just trying to do our part to make sure that St. Kitts can actually recover from this.
Yeah, people of St. Kitts and Nevis need to take this COVID-19 thing serious. The more cases we get, the more the place gonna lock down. Y'all making noise, but y'all still ain't doing what y'all supposed to do. Stop hard and use all your masks. That's the only thing gonna help right now.
I am Officer Donnelly Liebert Shiverton. Do you want to travel and don't have private transportation? Here are some travel safety tips to keep yourself and the persons around you safe from the coronavirus. When venturing out in public, it is recommended that you wear a mask at all times. Sanitize your hands before and entering public transportation. The bus operators are also encouraged to sanitize their buses after each trip. Remember, always practice good respiratory hygiene. That means refraining from touching your face with unwashed hands. Always practice physical distancing. To maintain physical distance, the government of St. Kitts and Nevis stipulates that only 2 passengers are allowed per row. That is, 1 passenger on each end of the bus row, while 1 passenger is allowed to sit up front with the driver. This means that only 9 passengers are allowed in a passenger bus. Remember, stay safe, travel wisely as we work to flatten the curve.
To avoid getting virus, to wash your hands thoroughly and frequently before and after preparing food, after using the toilet or changing a diaper for a baby, sick person, or the elderly, after blowing your nose, and after leaving large gatherings or moving away from persons who appear ill. Encourage others to wash their hands and also use an alcohol-based sanitizer of 60 to 70% solution. Away from events having large gatherings of people. You can expose yourself to more possible infections. Also, avoid sharing cutlery, cups, glassware, etc. with others. Virus may be transferred this way. Avoid shaking and holding hands and hugging or keeping an infected person in proximity. This is a message from the Ministry of National Emergency Management Agency, NEMA. The symptoms of the coronavirus are similar to those of the common flu or cold. which are consistent coughing, fever that does not go away, and difficulty breathing. If you are experiencing these symptoms, it is advisable to stay at home or if you want to go to your doctor, call and tell your doctor of your symptoms, any recent travel or contact with travelers. And lastly, please avoid spitting in public. Recent cases have shown that people most likely to be at risk if they contract the virus are persons over age 60 and persons that have an underlying medical condition such as hypertension, diabetes, kidney disease, or a respiratory condition. It is advisable to avoid those or other humans coming with people who are showing signs of the coronavirus. This is a message from the Ministry of Health and the National Emergency Management Agency, NEOC.
The Centers for Disease Control and Prevention, CDC, the expert body on coronavirus, has released guidance for general public and healthcare professionals on the symptoms of the virus. A person could be at risk if they have any or all of the following: fever and symptoms of low such as coughing or difficulty breathing after traveling to areas with positive cases, or having close contact with someone who is ill and is now under investigation for the virus in the past 2 weeks. Fever or symptoms of lower respiratory illness after having close contact in the past weeks with someone who has been confirmed to have the virus. The CDC defines close contact as being within about 6 feet 1.8 meters or within the room or care area of a person with the coronavirus for a prolonged period without appropriate protective clothing or having direct contact with the infectious secretions of a person with the virus without protective clothing. Coronavirus are particularly dangerous for people who have weaker immune systems, like young children and older adults. To protect yourself from the virus, try to avoid contact with people who have symptoms similar to those of pneumonia or the common cold, like coughing or a runny nose. Don't touch your eyes, nose, or mouth with unwashed hands. Wash your hands frequently with soap and water and scrub for at least 20 seconds. Use alcohol-based hand sanitizer when possible. Be careful when handling pets. The only current treatment for coronavirus being offered is supportive in nature. If you notice any of these symptoms and conditions, please contact your nearest professional healthcare setup. Help spread this information to everyone.
When you feel a sneeze or a cough coming, try to prevent sneezing or coughing into your hands, as this will contaminate your hands and spread germs. Covering your mouth prevents the spread of germs. You probably but the rubber up also matters, and that means breaking a habit you've done all your life. Cover your mouth and nose with flexible or a tissue, not your hands. Discard the used tissue in an appropriate bin immediately. Then wash your hands with soap and running water to help spread of germs. Turn on water. Wet hands. Soap and lather up. Focus on washing your hands for at least 20 seconds. Wash the front of your hands, the back, between fingers and on the nails. Rinse hands under running water. Use something to wash your hands, preferably a disposable paper towel. The best way to wash your hands is using running water and soap. But sometimes we don't have that available. When not available, use hand sanitizer that at least 60% alcohol content. Your health is your responsibility. This message was brought to you by the Ministry of Health, St. Kitts.
To avoid getting the virus, remember to wash your hands thoroughly and frequently, and after preparing food, after using the toilet or changing a diaper for a baby, sick person, or the elderly, after blowing your nose, and after leaving large gatherings or moving away from persons who appear ill. Encourage others to wash their hands and also use an alcohol-based hand sanitizer of 60 to 70% solution. Stay away from events having large gatherings of people. You can expose yourself to more possible infections in large groups. Also, avoid sharing cutlery, cups,
And I welcome you once again to the National Emergency Operations Center COVID-19 weekly briefing for the 25th day of August 2021. I am Les Roymans. Thank you very much for joining us. Recognize with us today the Honorable Wendy Phipps, who is the co-chair on the Disaster Mitigation Council. We continue to update you with what is happening in St. Kitts and Nevis with the management of the COVID-19 pandemic. The pandemic is still with us. And as we have seen in recent times, there is a growing number of cases. We thank you for playing your part in paying attention to what is happening at these briefings. You can manage yourself in a way that would reduce the number of cases that we have of the COVID-19 virus. So thank you again for joining us. I would like to invite Superintendent Cromwell Henry to present a report on the regulations. Superintendent.
Thank you, Mr. Williams, and a pleasant good afternoon to all broadcasts via whatever means. Today my presentation will focus on the changes in the new emergency powers regulation, which will include some measures for the upcoming Caribbean Premier League, or CPL as we know it, which is scheduled to begin tomorrow, August 26th. These new regulations commenced on the 23rd of August and will expire at 5 a.m. on September 6. The first significant change is the adjustment to the curfew time. Regulation 3.1 states, a period of curfew is imposed every day from 1:01 a.m. until 5 a.m. During this time, every person shall remain confined to his or her place of residence to avoid contact outside of the family, except essential workers who are required to report to work or for essential travel for emergency purposes. Businesses and establishments are required to close in sufficient to allow their staff and patrons to be in compliance with the curfew. Regulation 11.1 permits taxis, omnibuses, and passenger ferries to operate at full capacity. However, all persons traveling on vehicles shall wear masks at all times. The windows shall remain open or partially open if the weather permits, and they shall practice good hand hygiene and proper sanitary behavior. It is important that I highlight Regulation 11, which states the St. Christopher and Nevis Police Force and the St. Christopher and Nevis Defence Force shall have powers to stop any vehicle and inquire as to the purposes for which that vehicle is being utilized, and may arrest anyone found in violation of regulation. That is important for persons who utilize these public service vehicles and do not wear their masks. Please note that it could be arrest by any member of the police force or defense force. Regulation 14.7 now permits unvaccinated incoming travelers to quarantine at an approved private residence for 14 days with approved security. This private security must be approved by the Commissioner of Police. The option to quarantine at an approved quarantine facility or hotel is still available to these persons. Persons who are approved to quarantine at home will be given a set of guidelines and conditions of quarantine. Please note that it is an offense to breach any of the conditions of quarantine, and breaches will be prosecuted. A person shall only be released from quarantine upon receiving a negative RT-PCR test. Regulation 15 addresses sports and training. Sub-Regulation 3 deals specifically with League or the CPL. A fully vaccinated person may attend the CPL cricket competition matches scheduled to begin on August 26. All spectators shall be required to produce proof of vaccination by presenting the COVID-19 vaccination record or other valid proof of vaccination authorized by the Ministry of Health before entry into the stadium. The minor children of fully vaccinated parents or guardians may attend together with their parents or guardians. Only 50% of the capacity of the stadium will be permitted at the stadium at any time during the matches. The regulation requires organizers of the tournament to record the names, address, telephone number, and patient number of all persons entering the stadium. The local organizing committee has therefore established a set of entry protocols to achieve this. As you enter the queue at the entry gates, you will be hand sanitized and greeted by a team of CPL volunteers who will ensure that you have your vaccination card, your match ticket, and a government-issued ID. You will then have your temperature checked and your contact details recorded as you move through the line. By this time, you will be at the security checkpoint where the private security team will screen you for any prohibited items. Then you will present your match ticket to the gates person, after which you will be hand sanitized again and shown to your seating area. Within the stadium, the regulations require all persons to adhere to social and physical distancing protocols, wearing of face masks, and hand hygiene protocols pursuant to the regulations. Sub-Regulation G provides the local organizing and the managers of the event shall ensure that there is no music played at the event. Having said this, I will speak to a number of flyers stating advertising parties and other social events with bands and DJs. We wish to advise the public that none of these events has approved by the Commissioner of Police. We wish also to inform that it is an offense to host, attend, or visit any social event that has not been granted permission. Regulation 9 prohibits any person from hosting, attending, or visit any private party or other social event except with the written permission of the Commissioner of Police. Any breach of this regulation could result in either a fixed penalty notice of $500 being issued to the persons in attendance or criminal action where the penalty is up to $5,000 or 6 months in prison upon conviction. We again remind event organizers not to advertise any event before receiving approval. Any event being advertised without approval will not be approved. The current spike in COVID-19 cases will only trend downwards if we all be responsible and play our part by adhering to all the prevention protocols, which are avoiding crowds and crowded places, wearing face masks, sanitize regularly, and get vaccinated. Thank you.
Thank you very much, Superintendent Henry. I now invite our Chief Medical Officer, Dr. Hazel Laws, to present us with the Health Emergency Operating Committee Situation Report for today. Dr. Laws.
Mr. Williams, and a warm good afternoon to everyone. This afternoon, I will share with you the Health Emergency Operating Committee Situation Report. And I will end my presentation with a conversation. Okay, so I'll begin by highlighting the COVID-19 protective measures, which include the wearing of face masks times, sanitization, our need to maintain adequate hand sanitation, our need to maintain a safe distance between ourselves and others when in places, our need to boost our own system, and if you are experiencing any of the 19 symptoms, coughing, stuffiness, sniffles, fever, loss of the sense of taste and smell, stay at home. Yesterday, August the 24th, we shared information that 47 persons were diagnosed with COVID-19 within that 24-hour period. On Monday, we shared information that 60 individuals were diagnosed with COVID-19 between Saturday night and Monday evening. And then this slide actually highlights the daily count over this past week. As you can see, the highest counts were last week, Wednesday. 34 cases were announced, 34 new cases were announced last Wednesday, and yesterday, Tuesday, we announced 47 new cases. So as you can see, we are at the beginning of yet another wave of COVID-19. So as it stands, at present, the Federation would have reported 929 COVID-19 cases, 87 cases for Nevis, 683 cases on St. Kitts. To date, there have been 608 recoveries, and so at present, the Ministry of Health, we are monitoring 318 active cases, 318 individuals who are presently battling COVID-19, and so far, 3 COVID-19 related deaths. And so, over this past week, the Ministry of Health, we are recognizing that there are clusters of COVID-19 cases on St. Kitts and on Nevis. So what are the factors fueling this third wave of COVID-19 cases? So based on the information gleaned through the contact tracing process, we recognize that individuals are not adhering to the COVID-19 prevention and protective measures. Individuals are still intermingling, so they are not maintaining that safe distance between themselves and others. Persons are not wearing the face mask at all times, and they are not maintaining adequate hand hygiene. And a number of individuals are still unvaccinated. And when you look at the number of cases or persons diagnosed with COVID-19, the significant proportion of the individuals are unvaccinated. All right, so based on our last analysis, that was around about the 4th of August, at that time, a good 66% of the cases diagnosed were unvaccinated. So I want to pause and share a brief word with the 318 active cases. I want to recommend the following actions. These actions can facilitate speedy recovery. So we want you to ensure that you eat healthily in terms of adequate fruits and vegetables, at least 3 servings per day. So we want you to eat healthily. We want you to maintain adequate hydration. So make sure you take in enough water, simple plain water, along with the other drinks you may have. But maintaining adequate hydration is important. You must rest, and yes, you are in isolation at home or at a facility, but we want you to assign maybe 2 times per day you exercise. You get up out of bed if you are, and exercise at least in place. You can do push-ups, you can do upper body workout, you could do stretches, etc. So we want you to exercise in place, along with taking your multivitamins and supplements. That's vitamin C, vitamin D, and zinc. These are just some examples of supplements that can facilitate speedy recovery. So between May 19th to present, we have added 884 COVID-19 cases to our tally. Had 563 recoveries during this period, and as I said before, at present we are monitoring 118 active cases in the Federation, that's St. Kitts and Nevis. There is error on this slide in terms of hospitalizations. As we speak right now at this point in time, there are only 4 persons admitted to the COVID ward at the JNF General Hospital. 4 hospitalizations at present. So in terms of the way forward, the Ministry of Health continue to test. We test the contacts of the cases we have identified. We are conducting targeted testing and random testing in order to pick up all the COVID-19 cases. So within the present period on the discussion, May 19 to present, we have done over 20,000 we have processed over 20,000 COVID-19 samples across the Federation. So in terms of the way forward, we will continue testing, as I said before, and we will continue our robust contact tracing process, whereby all the cases identified, they are called, they are interviewed, by our team of contact tracers, and all their contacts are identified, placed into quarantine, and tested. Ladies and gentlemen, if we weren't doing this, our numbers would be much higher. In terms of isolation and quarantine, the 318 cases are in isolation, either at home or at a government facility, and we are asking you please to obey the isolation order. Your contacts, by extension, are automatically placed in quarantine, and we are asking all contacts of cases to please obey the stay-at-home order. We and the Ministry of Health, we will continue the clinical management of the active cases. We have a team of case managers who are ensuring that they are monitoring the 318 active cases just to ensure and facilitate their recovery. And then, ladies and gentlemen, we will continue our COVID-19 vaccination program. We started on February the 22nd. It's now 6 months hence, and we will continue. Over this past 6 months, we have administered over 45,097 doses of the AstraZeneca vaccine. We have achieved the following coverage rates: 73.2% of the target population covered with the first of the vaccine, and 63.3% of the target population fully vaccinated, covered with both doses. So at present, over 20,908 persons locally are fully vaccinated against COVID-19. And so our vaccination program continues. All right, so we presently have a batch of AstraZeneca Oxford vaccines in hand, and we are asking individuals who received their first dose, remember to check your appointment card and keep that appointment whereby you come in before the end of August to receive your second dose. I want to underscore this point because this present batch of the AstraZeneca Oxford vaccine expires at the end of August. So all individuals who received their first dose of the AstraZeneca vaccine between June to present, please make sure you come back for your second dose before the end of August. I want to just add that in the Federation, the vaccine, the COVID-19, will be administered to pregnant males upon submitting a letter from the attending obstetrician and gynecologist who would be granting clearance for such individuals, for such females, to receive the vaccine. So if you're pregnant and you've discussed this whole issue with your OBGYN specialist, once you submit with a letter to any of the health centers, the vaccine will be administered. Breaking news. Well, yesterday, the FDA granted full approval to the Pfizer-BioNTech COVID-19 vaccine. So this is the first COVID-19 vaccine that has attained full approval. So the Pfizer-BioNTech COVID-19 vaccine is no longer experimental. Prior to this, it was being administered on the emergency use authorization. So that's no longer the case. It has attained full approval. And so, ladies and gentlemen, it's with pleasure that I share that this vaccine is now added to the menu of COVID-19 vaccines locally. As of September the 1st, the Pfizer-BioNTech vaccine can be accessed right here in the Federation of St. Kitts and Nevis. And this is possible through of a kind donation from the United States of America's government. We received the first shipment on August 12th, and so we have 11,700 doses of this vaccine in hand. Just a little about this new vaccine that we will be offering come September the 1st. We will be targeting individuals aged 12 years above, and so yes, teenagers or high school will be able to receive vaccine, adults alike. So individuals 12 years and over would be able to access the Pfizer-BioNTech vaccine. The dosing regimen for this vaccine is that it requires 2 doses. So dose 1 is administered, and then you will be given an appointment, a 21-day or a 3 weeks appointment to come back for the second dose. So it's a little different with respect to, or as compared to the AstraZeneca Oxford vaccine. Now, in terms of the efficacy, so based on the data and trials run, the efficacy of the Pfizer-BioNTech vaccine against symptomatic COVID is as high as 95% for individuals 16 years and over. And in a recent trial involving adolescents between the age of 12 and 15 years, the vaccine efficacy against symptomatic COVID was as high as 100% after 7 days after the second dose, or dose 2. And so this vaccine enjoys a high efficacy. The efficacy against hospitalization is estimated to be about 87%. And when you are considering the Delta variant, the efficacy of this vaccine against the Delta variant of the COVID-19 disease, it is estimated to be 88%. And we in a battle, a war against the COVID-19 virus. So starting last week, we are noting a surge, an increase in our numbers, and this is signaling the beginning of our 3rd wave. So it's a battle. We are fighting for our lives. We are fighting not only the Lambda variant of the COVID-19 virus, but probably the Delta variant. We have evidence that there was one individual who came into country and was diagnosed with the Delta variant. The individual recovered. So at present, we are not absolutely sure if it is in circulation. However, we sent off a batch of samples to the Caribbean Public Health Agency for genomic sequencing. So in another week or 2, we will know for sure if the Delta variant is in circulation. But from where we sit in the Ministry of Health, it looks like that's the case. All right, so we are in a battle against COVID-19 virus. So what are the tools? What tools do we have as we fight this battle? So I'm going to end my presentation with a conversation tools that we have for us to win this battle, to learn to live with COVID. We have to adopt, we have to change how we do things in order to successfully live with this virus. And so I'm going to attempt to answer this question. How do you and I live with COVID-19? How do we include the COVID-19 protective measures in our natural way of life? When I say natural way of life, what am I referring to? I'm referring to how we operate at home, how we operate in the workplace, how we operate when we go to church, and how do we conduct business, and how do we socialize. I want us to pause before we act and move. We need to always consider our risk of exposure to the virus and then determine what we must do differently in the present context. So for example, I'm just coming from a funeral. Before going to the funeral, I asked myself, okay, so what would my risk be of exposure to the virus? What will I do differently as I journey, as I drive to this funeral? And so I made sure I had my face mask, I had my liquid soap in my car, I had my sanitizer in my car, and I said to myself, I will make sure I maintain that adequate distance while at the funeral. And so as we go through, as we ride out this third wave, we all need to pause before moving, consider our risk of exposure to the virus, and try and determine how will you operate? What will you do differently in the context of a third wave of this virus or of this outbreak? How do we operate at home? So when I'm in home in the mornings, I make sure I have my surgical face mask. I make sure it's on my face before driving out. When I get back home, I make sure to take off the face mask, discard the face properly. Do not leave it on a couch or on the dining table, or do not take it into your bedroom. When you get home, you need to analyze where you've been. You do while out. You may have to leave your clothes at the front door or leave it in the washing machine. Now, if you're a household with 6, 7, 8, 9 persons, you need to assess the level of risk to you in such a household. You may wear a face mask while at. You may opt to sanitize after or exchange other members in your household. How do you operate at work? When I go into the workplace, when I go into office, make sure I sanitize my hands upon entrance, my temperature, and there's a log that I've entered. And I think that's most workplaces are that the case at workplaces. Now, at work, when I'm interacting with my work colleagues, I make sure my mask, my face mask is adequate distance with my work colleagues. That's important. So I may be speaking with, interacting with them with adequate distance, must mean that adequate distance. And in transferring stuff, work and sanitize your hands before and after such transfers. So in my workplace, we pass files, from, to and fro. And so I sanitize my hands before and after. When I'm at the workplace and I'm using the restroom, I'm very cautious in terms of my approach to the restroom at work, because I share the restroom with other members of staff. So I sanitize before going in, and I sanitize upon leaving. And then I'm very cautious how I interact with the face basin and the toilet. Forgive me for going through this level of detail, but this is what it will take for us to make a difference and come out of this third wave. How do you operate at church or at a funeral? Again, you must sanitize upon entrance and exit. And while at church or at a funeral, you need to maintain that safe distance between yourself and others. While interacting with your acquaintances to make sure your mask is properly placed and it's on. And at funerals, you need to be wary of hugging and touching. So try and avoid physical contact when at church and at funerals. How do we live with COVID-19? How do you conduct regular business operations on any given day? So we may find ourselves at the bank. How do you operate in this context while we are going through this third wave? You must sanitize your hands upon entrance and exit. So when I go into the bank, I usually go to the counter, interact with the teller. Please note that the counter at the bank is a high-touch surface. The other clients that preceded you, they were using that counter. And so when you finish your bank transaction, it's important for you to sanitize your hands after such a transaction. When you're going to the supermarket, you must sanitize upon entrance. Be mindful of the cart or the trolley. Make sure that the handle of the cart was sanitized before you started using it. When walking down the aisles in the supermarket, you may see an acquaintance. You need to maintain that safe distance. Mindful how you interact with your acquaintances in the aisles of the supermarket. Always keep your face mask on and maintain that safe distance until you leave. Sanitize your hands upon exit. When you go home, you need to sanitize the grocery items, and you need to sanitize your hands after doing so. When you are going to the pharmacy, we all end up at the pharmacy at some point in time. Please note that there may be individuals going to the pharmacist who may be experiencing signs and symptoms of COVID-19. So you've got to be very careful when you are going to the pharmacy. You must sanitize upon entrance. They are now taking your details, your contact information upon entrance, and you must keep on your face mask while at the pharmacy. Make sure to sanitize your hands upon exiting the pharmacy. How do we socialize in this present context? We are in a third wave. So how do we socialize? Or maybe I should ask, should we be socializing in this context? Well, we are social beings. We can't exist without it. But we need to be wise. So you need to ask yourself, what type of social event is it? Should you really be going? Who will be there? Would it be very crowded? So if you are going to a restaurant or a bar, it's preferable if it's open air, so you have natural air circulating as opposed to air condition. And you need to maintain that physical safe distance between yourself, other patrons, other clients. Make sure your face mask is on. You take it off when you're eating and drinking, but you must adhere to the COVID-19 protective measures. On this slide, you see a group domino session. I'm not sure if this is advisable at this time. However, they have on their face mask, but guess what? The group at each table will be touching the dominoes, and so that therein lies the risk. So really and truly, there should be a hand sanitizer solution in the midst of that table, or there should be hand sanitizing stations at such a venue. So if you are going to socialize, you need to pause and analyze your risk, calculate your risk, make a determination if you really should go, and if you do go, how will you protect yourself? How would you reduce your risk of exposure to the virus while at that event? Ladies and gentlemen, as I said before, we are in a battle against this virus, and indeed we have the COVID-19 vaccine. Those of you who have not yet come on board, we wanted to emphasize with all about the COVID vaccine and recognize that it provides you protection against COVID-19. We want you to wear your mask at all times, maintain hygiene, maintain physical between yourselves, and if you're experiencing any of the COVID-19 symptoms, please stay at home. Do not attend the funeral or do not go to church. If you are experiencing any of COVID-19 symptoms, please stay at home. Thank you.
Much, Dr. Law. I now invite Mr. Abdias Samuel, the chair of the National COVID-19 Task Force and the National Disaster Coordinating Team, to make his presentation.
Good afternoon, all, and thank you, Mr. Williams. To our viewing and listening audience, I will try to be as brief as possible so that we can facilitate questions. All right, so like my colleagues, I just want to emphasize the health and the protocols for persons attending social gatherings. We know that the CPL will be the CPL will be happening, and it's a choice and a responsibility for persons who will want to go and enjoy the games to ensure that they follow the protocols. In doing so, it will be important for you to know that the National COVID-19 Task Force, in collaboration with the security forces and the health arm of the task force, has recommended to the federal cabinet for the area known as the party mall at the stadium for it not to be used for such activity. This has been communicated via the regulation and also to the relevant stakeholders that the party in the stadium will not be permitted. We also want to advise the general public that the federal cabinet being advised by the National COVID-19 Task Force has approved the virtual activities for the Nevis Culturama. So Culturama 47 festivities has been approved in a virtual form. So you will see that it will be a virtual edition of Culturama 47. So I want to thank Mr. Antonio Abonati Liebert and his team and Nevis for working very hard to ensure that there is some form of Culturama in Nevis, and this will be done innovatively, creatively through a virtual platform. Our understanding is that there will be a Soca Monarch tent that would start on the 28th of August, a senior Calypso tent, and the 4th of September there will be a Soca Monarch semi-final, and Sunday the 5th there will be senior Calypso semi-final, and they will have a culture pot on the 16th, which is the National Heroes Day. The poet in the square which would have been held at the War Memorial Square, we have advised them, meaning the Cultural Committee, to have that activity moved to another location and be done virtually. The Soca Monarch contest will also be on the 17th, and on Saturday 18th, the Division Heritage Day and Senior Calypso contest. And Sunday the 19th of September, which is our Independence Day, there will be a fashion show. And Monday the 20th, there will be the dramatic presentation. Again, only persons, we have asked that only the persons who will be carrying out the support staff functions and those who will be participating in those activities will be permitted to be at these venues. So again, we want to wish the Nevis Cultural Committee all the best in carrying out these festivities. The National COVID-19 Task Force will continue to work with the service providers and the Port Zante area to create a safe operating environment. We know that the Prime Minister yesterday would have announced in his press conference that the Cabinet has agreed for cruise ship to come to St. Kitts and Nevis using the antigen test, which was topic of controversy. With that said, we have set through St. Kitts Tourism Authority a number of guidelines for the merchants and other operators at Port Zante to become certified or travel approved certified. This means that you would have had to go through the training, the tourism training that was put on by Tourism and the Ministry of Health, as well as ensuring that the persons who will be working within the safe environment must be vaccinated, meaning that 14 days would have elapsed after the last dose, the second dose, sorry. So we are going to be carrying out some inspections. We're going to be working with a number of stakeholders. We are going to be visiting the Port Zante, having discussions with these so that we can have persons benefit from the arrival of these cruise ships in the near future. I also want to advise you that the hurricane season is reaching that particular challenging period, which is the beginning of September thereabout. We will see more activities in the Atlantic. With this in mind, I'm asking individuals to continue their preparedness measures. We would have had a threat from tropical storm Grace. She was gracious enough to pass a distance from us. We may not be that lucky in the future. So please do you use this opportunity during peacetime to prepare, revisit your hurricane plan. If you have one, if you don't have one, create a plan. If not, please call or visit NEMA social platforms, whether Facebook, YouTube, or otherwise, to get information or assistance. We have approximately 13 named storms remaining in the hurricane season. So therefore, use this time wisely to prepare. Again, I want to ask everyone to continue to exercise the protocols. As the CMO said, we are now experiencing the third wave with the consistent surge in cases. The discussion has been long and wide lockdowns, and that is not something that is off the table, but it will be the last option that will be considered or even debated. At this time, we are thinking that with the vaccination, that is a vaccination percentage that we have, and the practice of the recommended non-pharmaceutical measures, such as wearing your mask, washing your hands, I think that we can do our best to curb this particular wave. So again, we are appealing to everyone to exercise caution in going to social gatherings, exercise your personal responsibility, and ensure that you protect yourselves. We want to wish everyone all the best as the CPL Games will start tomorrow, 25 games, and we are asking everyone to be civilized in enjoying these games. So thank you very much, and we will now take your questions.
Thank you very much, Mr. Samuel. The first set of questions come from Win FM. CMO Dr. Laws reported a COVID-19 cluster in Nevis. Can Dr. Laws indicate where this cluster is? What areas are the cases being identified in Nevis? That's the first question. And the second one, of the 318 active cases, how many are local and how many are inbound?
Okay, so good questions, Mr. Williams. In my presentation, I said that we have noted clusters of cases, clusters of COVID-19 cases in St. Kitts and in Nevis. Nevis, to date, the biggest cluster is affiliated with a company. And then there were other smaller clusters in Nevis. That's all I would say in terms of my response to that question. And in terms of the 318 active cases, majority of these cases or patients locals, just a few inbound passengers. Within the past 2 weeks, just a few inbound passengers, probably about 4 or 5. I don't have the specific number with me at this point in time.
Thank you, Dr. Laws. This next question, a statement first and then the question follows. I was allowed to quarantine. This means that my abode has received approval as a quarantine site. Will this approval extend to other members of my household in the future, or do we have to repeat the process for each applicant? Mr. Samuel.
Thank you for the question. And yes, you will repeat the process of applying. When you apply, there's a confirmation number that's associated with your application that will be used in your form. Now, what would be eliminated from the process of having your home certified is having to do the inspections, because we already know how your home is situated and everything else. However, other situations can arise from that. For example, you may have additional persons in your homes that were not there before, or other situations also may arise from that. But we already know the circumstances of your home, and if there are no changes to your structures, what would be taken out from the process is just the inspection. That means that you may be approved a little more quicker than the usual process.
Thank you, Mr. Samuel. This next question, why do individuals who want to home quarantine in this have to pay $250 when it was said home quarantine is free?
Mr. Williams, thank you for the question again. In the original policy document, there is a 250 administrative fee to carry out this. However, the federal cabinet indicated that due to the constraints on persons in terms of financial constraint, that particular process be eliminated. However, if a Nevis, the Nevis Island Administration wishes to utilize the policy or adopt that policy for themselves over there to help them with their resources, because it requires a lot of resources, then that's a situation that they can adopt. But for us here, we are not charging the $250 as stated in the policy document.
And the last two questions for today, and they are from WinFM. How many active cases are on Nevis? How many have recovered? And how many are vaccinated? Are there hospitalized COVID-19 cases in Nevis? If so, how many? Dr. Laws.
Good questions, Mr. Williams. So many active cases are in Nevis. What I can say is we have reported a total of 929 COVID-19 cases for the Federation, 87 cases Nevis, 842 cases St. Kitts. In terms of active cases, we said the total federation-wide is 318. In terms of the active cases in Nevis, I don't have that figure at the tip of my tongue, but in terms of the number of individuals hospitalized in Nevis, it's 0.
Thank you very much, CMO. And that brings us to the end of our press briefing for today. I want to thank all the persons who presented today. Superintendent Henry, our Chief Medical Officer, we thank Mr. Abdias Samuel, the Chair of the National COVID-19 Force. We also thank Mrs. Christmas Jacobs for her valuable service of sign language, and we thank the Honorable Wendy Phipps for her support here at the NEOC. We thank ZIZ, and we continue to thank all the media houses in the Federation with us in providing relevant information because they play a great part in the management of the COVID-19 pandemic. Somebody sent me something about the Pfizer vaccine. The Food and Drug Administration in the US fully approved the Pfizer vaccine for persons 16 years and above. However, it still has emergency use for persons 12 to 15. I suppose that has to do with the data that they have. And I did research it, and the person is indeed accurate in what they said. Thank you very much for joining us for our press briefing today. We will be back next week with another press briefing. Continue to adhere to the non-pharmaceutical measures, and please go out and get the vaccine, those of you who are able to do so. And as Dr. Laws admonished us, we go to the CPL, we go at our risk, and we have to protect ourselves and protect each other. Thank you very much. I am Les Roy Williams.